Hi everyone. Okay, once again, welcome to my live video, Sunday 9 p.m. My video is on Vbac. Vbac, what is Vbac? Vbac stands for Vaginal Birth After Caesarean. People who had Caesarean birth once, that means the first pregnancy or whichever pregnancy, they have one time Caesarean section and they want to try natural birth the next time. So that is what Vbac is about. So why is it so special? Of course it's so special, that's why it got such a special name, right? You actually call Vbac. The only birth that you have such a special name is Vbac. So Vbac has a long story to talk about. So this is what I'm going to talk today, and I'm going to share a bit more about vaginal birth after Caesarean, which is called Vbac. Other than Vbac, there's another term that we like to use is called TOLAC. TOLAC. So it's trial of labor after Caesarean. So what actually happens is that doctors will call it as TOLAC, which is trial of labor after Caesarean. But among mothers out there, they like to say, I want a Vbac. What they want is a vaginal birth after Caesarean. A mother wants a vaginal birth after Caesarean, but to the doctors, what we are going to give you is a trial of labor after Caesarean, so which is called TOLAC. Okay, so that is the two terms that are more or less related. And why is this an important topic? Because there are certain things you need to know, there are certain facts you need to know. Number one, we didn't have so much of all this Vbac problem in the past because women in the past, we have less Caesareans in the past. If you ask me 20 years ago when I was doing obstetrics, probably only about 10% of women end up with Caesar. Today, about 20% of women end up with Caesar. So you can see the number of women ending up with Caesar has already doubled. And then a lot of women will see that, oh, my previous, my mother, my sisters, my aunties all have natural birth, but I ended up have to do Caesar. So we always feel like we are the so-called abnormal one, because why everybody can have natural birth and I cannot? So there are a lot of women that feel that it is something they cannot accept because they see other people all having natural birth. I think now is one. Even those days, my mom is one example. My mom had a Caesarean for me, and she was so shocked when she had a Caesarean. She said, oh, never heard of anyone with Caesarean one. So those days, it is so rare. So my mother's time, 40, 50 years back, it was so rare. They never even heard of the word Caesarean, you know. It's like everyone who goes and give birth is like almost 100% natural birth. So you see, 40 years ago, it's like almost 100% natural birth. 20 years ago, 10% of women have Caesarean. And today, 20% of women have Caesarean. So what is going on? We know one thing, the number of women ending up with Caesarean is going up every day. Every day is going up. The trend is going up. So this is the first fact you need to know. Then another fact that caused a lot of women fight so hard to have a Vbac is because, you see, when you have one Caesar, it's fine. But once you have two Caesar, let's say your first baby and your second baby is Caesarean, then the moment you get pregnant again the third time, the doctor will say, number one, you don't have a choice already. You need a Caesar in the third pregnancy. And number two, the doctor will tell you that not just you need to have a Caesar, you may need to tie your tubes, which means 3 is maximum. Okay, most government hospital will put it as 3. Some private doctors may allow 4. But in Malaysia, they say 3 or 4 is maximum. And a lot of women are very shocked when they hear that, because when they had the first Caesar, nobody told them that by the third Caesar is maximum, and not just maximum, you have to tie your tubes. So you know, there are a lot of issues in the third pregnancy when you tell a woman to tie the tubes. They cannot accept it for many reasons. It could be number one, they cannot accept it because maybe all 3 are boys or all 3 are girls. You know, everybody hopes to have both boys and girls, right? So all 3 boys or all 3 girls, so they cannot accept it. Or the second reason could be they hear that a lot of things, they hear stories about tying the tube. You know, there are a lot of stories about tying the tubes causing this problem, that problem, that problem. In fact, I have one video on these stories about all this tying the tubes. Does it cause problem? So all these the myths that there are out there, actually a lot of people believe. You want to know more explanation of why this myth actually comes up, you can watch my video in my YouTube channel. My YouTube channel is Dr. Tan City Clinic. Yeah, you don't just watch. Yeah, please subscribe. Yeah, so watch the video there, and you will understand why a lot of women are very, very scared to tie their tubes. So because of that, the moment the doctor break the news that ma'am, you need to have a Caesar this time because already 2 times Caesar, that time she may still be okay. And then the moment we tell that not only that, you know, this Caesar you need to have you need to tie your tubes, then they are shocked and they cannot accept it, and that is when they start going around finding solutions. And it's very sad when they find certain solutions that ending up they lose their life. Because if you Google some news in Malaysia, local news, woman with 2 times Caesar tried to deliver normally at home and died at home. So these are the things that women can go all out to do because they cannot accept it. Or it could be also, reason is religious reason. There are certain religions in this in our country that still very against tying the tube, because baby is a gift from God. If God give you, you must accept. How can you stop God from giving you the gift? Then by tying the tubes, that could be a problem. Or it could be insecurity in certain women. What if I tie my tubes, then my husband go and use that as a reason to find a second wife, a third wife, a fourth wife? Because in Malaysia, you know, majority of men can have 4 wives. So when your husband is entitled for 4 wives, you do have certain amount of insecurity, because what if my husband wants some more babies and my tubes tied already, then my husband will find another wife. So there are a lot of problems attached to this. So that's why for women out there, I always say, number 1, if your first birth is a Caesarean, your second birth, if you think you won't stop at 3, if you think you cannot tie your tubes in your 3rd pregnancy, if you have these thoughts, or if you think there's another reason why some women want to try natural birth, they feel that they miss out on motherhood, on womanhood, whatever they call that. They feel they did not experience everything a woman should experience. So if you have these type of thoughts, your second pregnancy, your so-called your Vbac pregnancy, it is a pregnancy that you need to work for it. You need to work for it. And that is why I have this talk today. You need to work for it, because you need to understand what is the reason you had Caesar the last round, whether you will have another Caesar today, this time. Is there anything you could have done to have changed the outcome? Could you just let it be and see whatever happens? So this is one thing you need to understand. Your first pregnancy, you already given a chance to deliver normally, but maybe you didn't do your homework. You didn't do all the things you need to do to make sure you have a natural birth. You just let it be. As I wrote in my book, don't just let it be. Because sometimes nature has decided that you need a Caesar. Because the things that happen throughout your whole pregnancy has already determined that you need a Caesar. So if nature has decided that you have to have a Caesar, if you're just going to let it be and you don't do your homework, then you will eventually end up with Caesar. If you can accept a Caesar, no harm. But can you? This is the question you need to ask. So you need to ask yourself question number 1. Can you accept Caesarean for all your pregnancies? Number 2, can you accept if the doctor say you can only have 3 kids? Number 3, can you accept on your 3rd pregnancy your doctor going to tie your tubes? If these things are something you can accept, like you feel that, I mean, if have to lah, it's okay. I have to accept it. I have no choice. I should be thankful that I'm blessed with 3 wonderful children. Of course, no problem. Or maybe you will think that I only want 2 kids anyway, so it's not an issue. But if you cannot accept these 3 things, then you really need to work hard on your birth. It's not just your second birth, but also your first birth. If your first birth, you have done your homework and prevented the cesarean, you don't need to work for a Vbac anymore. But if your first birth is a cesarean, then your second birth, you really need to work towards a Vbac. It doesn't come to you. You have to work for it. So now the question is, why some women really want a natural birth so much? I have seen many women who come to me who say, I had cesarean, but this time I want natural birth. So there are actually many reasons to it. Honestly, there are many reasons. It could be as simple as I mentioned earlier. They just wanted to feel what it's like having a natural birth. They feel that it's part and parcel of being a woman, part and parcel of being a mother, and they really need to have it. Or it could be other reasons. I have seen mothers who come to me with a cesarean, and they want a natural birth so much because of the first cesarean that has certain complication. The complication can be the complication towards them, like maybe their wound breakdown. Can you imagine wound breakdown? If your wound break down, you will never have a Caesar again. What is wound breakdown? Means your wound open up. You know, your doctor stitch nicely and then you go home, and then after 1 week, the wound just open up right in front of your eyes. Both natural birth and Caesar also can wound open up one. But natural birth, a lot of women, the wound open up so they don't know. They cannot see. A cesarean is going to open up in front of your eyes. So that can be a very traumatic experience. Or the experience of going through the entire natural birth and ending up with a cesarean that end up with the entire cesarean. It is very traumatic to go through double birth, you know. I call that double birth because they experience both all the labor pain and at the same time they have to experience the cesarean. So it can be a complication of the birth itself, or sometimes certain things that happen at the point of a cesarean which traumatize them, not just physically but emotionally, because there are certain women who want to have natural birth so much, and when they are asked to do Caesar and they are resistant or they are not keen, and then some people will start using words to blame them, like, you can't be so selfish, you need to think about your baby, you know, if you go on like that, your baby may die. This is actually, in a way, a form of birth trauma towards the mother. Sometimes we word it very nicely also. It's safer to have the cesarean at this point. I think it's better to have cesarean. But to the mother, she may interpret it as, if I'm going to hold on, I am going to cause my baby to die or endanger my baby's life. So this is a form of emotional trauma during labor. So some of these women, when they actually want a vaginal birth so much in the second pregnancy, it is very often because of certain trauma. So it can be either their physical trauma or their emotional trauma during the last pregnancy, or it could be a complication on the baby, because Caesar, we know, is not as good for the baby. So baby may end up with asthma, allergy, a lot of skin rash, and some mothers just blame themselves. They blame themselves, they feel like, I'm not good enough, lor. I'm not good enough. That's why I ended up with Caesar and my child have to suffer. So again, they blame themselves. So they blame themselves. Then the second pregnancy, when they are pregnant again, they will work very hard to get the birth they want. So it's very often some form of trauma. Because if not, honestly, I have seen many women who had 2 Caesars, 3 Caesars, and they're very happy with the Caesar. They never even think. They come to me from the very beginning of pregnancy. They tell me straight, "Doctor, I want a Caesar." There's nothing you can say to convince them to do something else. They will just tell me, "Doctor, I want Caesar." Next pregnancy, I also want Caesar. Next pregnancy, I also want Caesar. And they're very happy with it. And in fact, these are the group of women that even sometimes they go around tell the whole world, They tell the whole world, Caesar is the best, Caesar is so nice, Caesar is a very fast recovery, all planned, no uncertainty, pain-free. So they actually market Caesar it's like a marketing person, like a salesperson selling Caesarean birth. So you see why all these women, they find that Caesarean is pain-free, no suffering, whereas there is also another group of women that will find that Caesarean is horrible, and that is why the next time when they're pregnant, they don't want to go through Caesar, all because of the experience they have and the trauma they go through. Women who have a traumatic birth when they have the Caesarean, they will never want to go through a Caesar again. So as I say, the trauma need not be a physical trauma. It can be an emotional trauma. I've also seen women who traumatized because her mother say, "You don't know what's wrong with you, I give birth so easy, your sister give birth so easy. Don't know why you so difficult." This type of words from her own mother can be very emotionally traumatizing. So these type of traumas are the one that drives these women to go to do a Vbac. Now let us talk about Vbac. Are there problems? What are the problems that women will face with Vbac? Number one, there's actually a risk. We worry about what? We worry about scar rupture. What is scar rupture? That is when your old Caesar wound open up during your next labor. Scar rupture can happen anytime actually throughout pregnancy, but most often it will happen when you are in labor, if you try to have natural birth. And so that is why there are certain people who are very, very scared to do a Vbac. It can be the doctor who is very scared and tell you, "No, you have 1 Caesar, it's better not to try. After the scar rupture, your baby can have this problem, that problem. You can have this problem and that problem. It's life-threatening to both you and your baby." I agree. I totally agree. So even there are some patients, some mothers, when you tell them, if scar rupture, both you and your baby can be in danger, you may also don't want to try. Or maybe you want to try, but the moment your husband know that if you try, you are endangering your life or your baby's life, your husband may say, "Better Caesar straight lah." See? So there are people who do not want to try at all. But generally, as a guideline or a SOP, we usually still allow after 1 Caesar. Not after 2 Caesar, we usually don't allow because the risk of scar rupture doubles. 1 Caesar is near 1%, it's almost 1% chance, but once you have 2 Caesars, the chance double. So because the risk is higher, normally we say no. So because of that, don't wait for your 3rd pregnancy, then only you start opening books, attending courses, listening to talks. Don't do that. You should start with your 1st pregnancy. Why? Because 1st pregnancy, low risk, no risk, trying natural. Go all out for your natural birth in your 1st pregnancy. Don't listen to all the, I have a lot of old mothers, interfering their births of their daughters. They'll say, "No need lah, no need attend class, what so no need, you just let it be. Let nature take its own course. You'll be okay one." But they don't know that those days, so few people end up with Caesar, but today 20%. And the question is, can your daughter accept it? Can your daughter accept everyone else in the family natural birth, but she's the only one Caesar? These are the things we need to think. So first birth, no risk. No risk. Also, you need to attend classes, you need to gain knowledge, you need to do your homework, you need to do a lot of things throughout the whole pregnancy to make sure that you do not end up with Caesarean in your first pregnancy. If you end up with Caesarean in your first pregnancy, then second pregnancy, you have to work double to get your natural birth. And if you still fail 2 times because you put in 100% of your effort for 2 rounds, then my advice for you is, let it be lah. Third pregnancy, accept the Caesar. You have tried your very best. So you need to try your very best from your first pregnancy. Don't be a Vbac if possible. Don't try so hard only in your second pregnancy. I have this one mother I still remember. In her first pregnancy, she didn't do anything, she just let it be. And then she also opted to give birth in a government hospital. And then I still remember at the very last month, I think I always tell a lot of women, from far I also can know whether your chances of Caesar is high or low. We can see there's certain features in mothers who are more likely to end up with Caesar. So that time she's going to government hospital, what can I do? But I just told her lah, you know, all these features you have to be mentally prepared. You may end up with a Caesar. Just be mentally and emotionally prepared. Go and try lah, because government will let you try anyway. Go and try all out. But be mentally prepared lah. But because you go into government hospital, I also can't help you too much, so my hands are tied. But go lah, try lah. You know what she told me? She told me at the very last minute, when the government doctor told her that she need to go for a Caesar, not just, it was like another 1-2 hours. Doctor say, in the next 2 hours, if you still don't deliver, you need to go Caesar. At that time, she told me, she suddenly missed me so much, missed me so much. So in her second pregnancy, she told herself she's not going back to government hospital anymore. And this time, she get me to deliver for her. But in my heart, I was thinking that, yeah lah, of course she achieved her natural birth this time. But in my heart, I was thinking, why didn't you do that the first time? You know, the first time you got no risk. You got no risk, you should have let me deliver, and that's fine. And if you have natural birth for your first baby, second baby, go government lah. No risk already, and you already got natural birth. You go government, second baby, most likely you'll get natural birth one. Okay, but not so much first pregnancy, especially in very difficult births. That's why I once also share with a colleague of mine who is actually a head of department in one of the government hospital. I told him, my Caesarean birth is less than 10%. Then he told me his hospital Caesarean birth is 20 to 25%. Then he wondered, why my Caesarean birth can be less than 10%. And when I share the things that I told him, he totally agreed with me. Why? Because number one, I encourage natural birth is one. His hospital also encourage natural birth, but I deal all my cases myself. I use my own hands to assess. I use my own hands to do whatever I can to help. Then he totally agreed, because he's as experienced than me. In fact, he's more experienced than me. So he knows if he himself managed some of those cases in the government hospital, it would have avoided the Caesar. But cannot, because in government hospital, there's just too many patients. So he has to leave it to the most junior people to handle as well. The most junior people also handle a certain percentage of mothers who give birth in the government hospital. And if you give them a difficult case, those that are very difficult to give birth when nature has decided that these mothers should Caesar, leave it in an inexperienced hand, even though his heart is all out to let you have natural birth, but he does not have the skill and the ability to do so. So that's why that is the only difference. Private doctors with experience and the heart to really help mothers to achieve natural birth usually have less seizure than government hospital. So government hospital, they have the heart, but what if you are not in experienced hands? So sometimes no choice. So that's why their seizure is more than us. So, but I cannot say that all private hospital has less seizure, because there are certain doctors who are not willing to take risks, and therefore their cesarean will be even more than government hospital. So that is why I always say the key to natural birth, number one is choose the right place of birth or choose the right doctor is very important, number one. But at the end of the day, it's still you. In fact, the most important thing is you as a pregnant mother should do your homework, do your research, take courses, study, learn, and do the right thing. You must know how to prevent a cesarean. Okay, next I'm going to talk about all the pros and cons of natural. So let's say if you have one cesarean already, what should you do in your second birth? I always say, whether it's your first pregnancy or a VBAC, I always like to tell mothers, you have to first ask yourself, who are you? There are three types of mothers in this world. There are three types of mothers. There are also three types of doctors. There are also three types of government hospitals. Although we say government hospitals tend to encourage natural, but there's still three types of government hospitals. Okay, what is it? Group 1 are the ones that we call the average group of people, or I would say also the majority type of people. The people that everything follow SOP, follow guideline, follow all the things that's set by the government, Malaysia government, ministry, overseas guideline, everything set. Just follow blindly, just follow. Because it is a guideline already set, must be true one lah. Just follow. And this is the majority of government hospital, as well as is also the majority of what do you call that? Majority of private gynaes as well, and also majority of mothers, no issue. But there are also another group which are more prone to seizure. Even in government hospitals, there's certain government hospitals that have more seizure than the rest. And gynae in private, also some don't like to take so much risk. Even if the risk is 0.0001%, he will say that you need to seizure. And in fact, there are also some patients like that who are not risk takers. I also have mothers who tell me, I'm not a risk taker. So they don't want risk, they just want simple, easy births, they are fine. Not risk takers means, if my birth is going to be simple and easy, I'm fine. If I'm going to have a difficult birth, I'd rather seizure. Let's not take the risk, just seizure. So this is one group. Another group, which is the third group, which are more towards natural. That means even in certain government hospitals, there are certain government hospitals got less seizure than the rest of the government hospital one. There are still government hospitals that still have seizure less than 20% one. And gynaes in private also the same. There are also certain gynaes that are more prone towards natural birth one. They will try. Even the guidelines say like this, maybe I can adjust something lah. And then at the end, I don't fit this guideline criteria anymore. So I can still go for natural law. Or how we interpret the guideline sometimes also matters. If I'm more prone to natural, I will interpret it this way. If I'm more prone to seizure, I interpret it a different way. So even patients, mothers who are pregnant, also got certain group that are more prone to natural. They want a natural so much one. It's very difficult to convince them to go do seizure. And if they do seizure, also the next one they will still try very hard one to have natural one. So I always feel that you need to first ask yourself, who are you? Because who are you then you only can decide which hospital to go to or which doctor to go to. Then hopefully your demands are met lor. Because I have this one lady who once PM me. This mother, she gave birth in one hospital in the private, and this doctor is very famous one. It's not me. She PM me for opinion only. This doctor is very famous for pro-natural, very supportive for natural birth one. You know, when doctors are very supportive for natural birth, doesn't mean that 100% of their patients will end up natural birth. Still will have like 5 to 10% end up with Caesar. So this lady went through everything, the entire natural birth, and at the end she is the 5 to 10% that ended up with Caesarean. So when she ended up with Caesarean, you know lah, hospital bill double already. You have to pay for the whole natural birth and the whole Caesarean. And she was actually quite angry with the doctor. She's very angry. She feel that if the doctor so experienced should know that I will end up with Caesar one ma. Trust me, we know also. Yeah, as I said just now, we more or less know one. But when we are pro-natural, we still try to help you. Because even though we know, half of them still end up natural one. Even though we know you are a difficult mother, but I can do something still. Maybe with what I can do, I can still help you. Yeah, so most of doctors who are pro-natural, they tend to be more supportive towards the mother, and they tend to make sure that the mother gets the maximum chance she can get. Really cannot, then have to Caesar lah, yeah lah. But this lady was very angry. So when she PM me, she tell me the whole story of what happened. And then you know what I told her? Well, why did you choose this doctor? This doctor is all out natural one. That is why she's so famous. Because a lot of people who really want natural will love her so much. Because it's like this, a lot of mothers go to this doctor, say Caesar, go to that doctor, say Caesar, go to her, natural birth. So she's so good. Well, you will go to and choose this doctor, you will be allowed a chance to do so. But if you're not that type of mother, then why did you go to her? You should have chosen a doctor that is either middle path or prefer to Caesar. Because prefer Caesar, when they see you difficult birther, no need to try, straight away Caesar. But doctors who are more prone to natural birth, they will give everyone a chance to try. And they will still try their very, very best to help you get your natural birth. And very often, the difficult birthers still manage to deliver normally. So, that is why she is so famous. So now you understand. You need to ask yourself. That's why through my years, I also told myself, I also need to ask my mother. Because I am very pro-natural. But sometimes my mother is not pro-natural. So if they are not pro-natural, I also must know my limit, how much I should do. So sometimes I also ask the mother, where are you in these three options? You have to let me know, where are you? So if you are here or there, I will know what to do. Because not all mothers are all out natural. That's what I realized after this particular case who PM me. Then I realized that maybe some of my mothers are also very angry with me, but they don't tell me, you're going to ask another doctor. So nowadays, I try to understand my patient. Okay, now we want to talk about natural and Caesarean. Why is there a difference? Is there a difference whether you're natural or Caesarean? Both has its pros and cons. So if you're talking about life and death matter, natural birth is safer for the mother. It's safer for the mother. Because to the mother, natural birth is a very natural process, just like you go and pee or go and poo. But Caesarean birth is safer for the baby. Because natural birth, they can have a risk of, number one, we worry about fetal distress, whereby the oxygen will be depleted to the baby's heartbeat drop, baby heartbeat weaken, and can endanger baby's life. Even if the baby don't die, may end up with mental retardation. So that's why Caesar is safer for baby. We make a big hole and take the baby out already. The baby doesn't need to go through the entire stress of labor. You know, the natural birth, that part is so tight, you know. So just some cord or here and there, just press onto the cord. The baby cannot breathe, no more oxygen. But Caesar, no. We just open big. We just open big. If we face any problem, that's why we all been taught in doing Caesar. If you face any problem, just cut bigger, you know. So we can open so big. There's no risk for the baby. Of course, don't be too afraid lah. We don't cut so big from the beginning. Only when we face problem, we cut bigger lor. So you see, we can cut bigger if we face any problem and take the baby out. And then if you're talking about Vbac, there is, if the scar were to rupture, then the risk to both the mother and baby is there, but actually the risk is bigger on the baby. So again, if you choose to go for Vbac, actually you are putting your baby's risk a bit higher than yourself. So that is both life and death. But of course, we also need to talk about other side effects lah. Okay, natural birth got side effect or not? Got. It's safer for mother, but for baby, for mother got side effect. You can have urine incontinence. You can have uterus prolapse. So these are the side effects of natural birth. If you talk about side effects of Caesar is safer for baby, but got side effect on mother, on the baby also. Caesarean babies are usually, we say, more prone to asthma, more prone to allergies, and also higher chance of going into ICU after birth because of a wet lung. They have higher chance of wet lung because they don't go through the natural birth process to clear off all the water from the lungs. So sometimes the baby come out and the lungs is wet and need to go to ICU after birth. So Caesarean babies have some side effects on the baby, and because of the probiotic that they don't get from the mother at birth for Caesarean, so they are also slightly weaker as a baby when it comes to their immunity. So that is the difference between natural birth and Caesarean. So now you know this. So if you are a mother, pregnant mother now, where I don't care whether you are first baby or now you're trying for Vbac, you have to ask yourself first, which group do you belong? The three groups. Which group do you belong? So you need to ask that your first question. Second, you have to know the pros and cons both sides. Then you need to ask yourself which risk you're willing to take, which side effect you're willing to accept. This one you have to think. There is no perfect birth. Natural is not perfect, Caesar is not perfect. All got risks and all got side effects. And next, you need to ask yourself the question I said earlier. If you're going to have a Caesarean, are you okay if at the end you have all Caesar, and by the third pregnancy, maybe doctor will say that's your last, and by third pregnancy, when you do a Caesar, your doctor may want to tie your tubes. This is a question you need to ask yourself. Can you accept that? If you cannot accept that, then you really need to work hard for your natural birth. And to work hard for your natural birth, you need knowledge, you need to work for it, you have to do your homework, you need to do your research. It doesn't come to you for free. Okay, one last thing I just want to touch upon before I finish my talk is, I told you earlier, there are certain mothers from far you see them, you already know whether they are easy birthers or difficult birthers. What is an easy birther and what is a difficult birther? Which is again something I explained in many of my talks, my seminars. To say whether a mother is easy to give birth or difficult to give birth, there's only two factors. One is, I look at the size of the baby compared to you. Not what's your baby's birth weight only, Let's look at the baby's weight compared to you. If you are 160, 170 tall, 4 kilo, also simple birth. But if you are 145, 150, even if I give you a small baby, it can be a difficult birth. So the first thing we need to understand is the discrepancy, whether the baby fits your size. There is a myth going around that all babies will fit the mother's size. No such thing. There is a size and every woman have a size. That is why there's such thing as obstructed labor. There are people who go into obstructed labor. If you go and look at all the sad stories in Africa, that's what happened. No? Because they have no hospital, they cannot do Caesar. All these mothers go into labor back in their homes only by hopefully trained midwives. And they're in labor for days and days and days and the baby just cannot come out. And then eventually the baby die. Then they had to walk for kilometers and kilometers and kilometers to reach the nearest hospital that can do a Caesar for them. There's so many women out there in Africa going through that, and WHO have so many camps for this type of women because they not just have a Caesar, they actually have a lot of complications because of the obstructed labor for so many days. So there's no such thing as every baby fits the mother. So there is a size. And the second question, the second factor is your cervix. How easy does it open? Does it open easily? Or the ones that are difficult to open? So difficult to open, I call them stubborn cervix. Stubborn! So difficult to open. I have induced certain mothers 5 days just to wait for the cervix to open. So stubborn. So, to know whether a person is easy birther or difficult birther, we have to have these two. If your baby fits your size and your cervix is not stubborn, then you are an easy birther. If your baby fits your size but your cervix is stubborn, you are a slightly difficult birther, not impossible but difficult, slightly difficult. If you have a very big baby that doesn't fit your size actually, but your cervix is very nice, very easy to give birth one, these group mothers also just slightly difficult. In the right hands, you should be fine. In the right hands. If you have a very big baby for your size and plus a stubborn cervix, this is what I call like impossible birth, you know. So this type of impossible birth is the type I always call difficult birthers. And difficult birthers need to find doctors who are very, very pro-natural. Because even you follow SOP, you will end up with Caesar one. These very difficult births, I always call them, you are destined for Caesar. Now the question is, what can we do to change your destiny? Nature has decided for you to Caesar. But what can we do in these 9 months to make sure you can still have your natural birth? So this is what is important, to get the right doctor and also get the right knowledge for yourself. So where to get this knowledge? First, I have a book. I forgot to bring my book, but I have a book. So if you have not had the book, maybe you should buy the book. Have about more than 10 cases of mothers, actually all first-time mothers, who delivered via Caesarean section. And then I analyze the entire case and I share with you how this birth could have been prevented. That means this mother actually, if she has done something different, maybe it would have been a Caesarean, a natural birth. So what can you do to make things different? So this is the book that I wrote. So this book actually you can buy anywhere. You can buy this book from Lazada. You can just buy this book from Lazada. Recognize my book. This is my book. You can buy this book from Lazada. You can also buy this book from my website. So this is my book. Yup. Oh yeah. There goes my husband. Oh, so kind of him. He has just delivered my book to me. So this is my book. So you can buy this book either from Lazada or from my website, which is City Woman and Child Clinic. So you can buy this book. If you buy this book, I actually share a lot more of all those things I mentioned earlier about stubborn cervix, how to solve this stubborn cervix problem, and many cases about different women with different height, different size, and different birth weight, and what size fits what mother. So if you want to know more, you buy this book. Another one is later I will share a link with you. I actually having a Vbac seminar next month. So if you really want to try to have a Vbac, Or if you are a first-time mother and you really don't want to end up with a seizure in your first pregnancy, please attend my Vbac Seminar. Vbac Seminar is a bit different from my normal, usual online parenthood seminar, because one thing, Vbacs are a lot more difficult to give birth than first-time mothers. So the things that they need to know, the things that they need to do is a lot more. So that is why I have a whole seminar on Vbac, which I have been doing for the last few years. So this year we do everything online. With this MCO, and also I feel that I cannot always close my clinic for seminars, so I decided to do everything online. Because when I close my clinic, I need a very big crowd. If not, it's also not worth doing. So with MCO, I cannot have big crowd. And some seminars also may not have such big crowd, like Vbac, the demand is not so high. So I rarely do, but then I actually help very few mothers, so I might as well do online so that I don't care how many people register, big number, small number, I don't close my clinic for it. So if you really want to have a Vbac, you really want to have more knowledge, please sign up to my Vbac seminar next month. I will put the link in the comment section. And now, if you have any questions, please put your put your link, your question now in the comment section. I will try and answer all your questions. And not only that, for my future seminars, for my future live videos, if you have any questions that you want me to share in my video, please put your questions in, okay? I do run out of questions. I need your suggestions. So please put your suggestions in the comment section so that I can look at it and I will see which one are the interesting topics that you want me to talk, and I will talk about it, okay? So I hope you have gained some knowledge from this seminar today. Let's go through some of the questions. If see any one of you give me any questions, I'm sure if you are a Vbac mother, you will have taken the opportunity to ask me. T. Wen Yen asks, if the baby is in breech position, any chance of natural birth? Yes, because you can do ECV ma. You can do ECV to turn your baby. For all my patients with breech, okay, breech, there are actually 3 options. You have 3 options. One, you can have Caesarean, you can have natural, you can do ECV. If you're talking about breech, okay, if you want to know more about breech, you go to my YouTube channel lah. My YouTube channel, Dr. Tan City Clinic. I actually have one whole video, live video that I did previously on breech only. So you can actually either turn the baby or have natural birth. In the past, when I was a doctor, younger days, when I was in my 20s, all the breech, actually almost all the breech deliver normally one. You ask me, I have delivered all kinds of breech, whether bump first, leg birth first, whatever. We have delivered before, and it can come out one. It's not impossible. But of course, there are some risks involved lah. So because of that, then now we either say it's either you Caesar or you turn the baby. But the right thing to do is to turn the baby. Mothers who belong to the mothers who want to have natural birth, you must make sure you turn your baby using ECV. Go and find a doctor who can do ECV. Not all doctors can do. So the thing is, sometimes doctors who cannot do or lazy to do, I don't say all doctors cannot do. Some doctors know how to do, but very lazy. Because ECV not easy. I have sprained my finger 3 times, do ECV. So some doctors very lazy to do already. Why injure yourself, do an ECV, right? So find the doctor that can do ECV for you. Doctors who cannot do ECV, they always find excuse one. They always say lah, baby too small lah, too big lah, water enough, not enough, what lah, Vbac lah. All these are excuses. Actually, they don't want to do for you. But if you find a doctor who want to do for you, you can still do an ECV to turn your baby. Because once you do not turn your baby, then the head is down, then you can natural birth lor. This ECV is nothing new. Long ago, or even in a very rural countries until today, there's all this old what do you call that? Tukang urut, we call the mesua in the villages that know how to turn baby one. Okay, so it is nothing special. It is nothing special. Actually, it's quite easy, and nowadays you turn your baby with doctors, under doctors' hands. We scan your baby, we check baby's heart rate, very safe one. So go and turn your baby, okay? So breech, yes, you can have natural birth, but you need to turn your baby. You need to know more about breech, please go to my video on breech, okay? Fatin asks, What is the features of mother who will end up with cesarean? I told you, number one is the size of the mother and the size of the baby. So when you look at the mother, small size, the tummy like want to burst, you know it's going to be a difficult birth already. Another thing is factors that affect stubborn cervix. One of the factors, there are many factors that affect stubborn cervix, but one of it is what do you call that? Obesity, overweight. So when you see the mother from far, fat one, you also know most likely stubborn cervix lah. Okay, so these are the things from far you can tell one. Okay, Fatin asks, is there a way to control baby size? Yes. Control baby size, control mother what the mother eat The problem with Malaysians are, number one, we love rice. Rice make baby very big. Number two, we love nasi lemak. Nasi lemak also make baby very big. Number three, we love durian. Durian also make baby very big. Number four, we love roti canai. Roti canai also baby very big. Char kway teow also baby very big. Okay, got to do with diet. Ultimately, the mother's weight gain throughout pregnancy. Don't be overweight. Don't be an overweight mother. Don't put on too much weight in your pregnancy, and take care of your diet. Okay, find out what are the food that cause baby to put on a lot of weight. Go to my seminar and you will know. We share it as well in the seminar. Okay, Catherine Tan, I know a lot of friends that opt for Caesar although they can go natural. Yes, Catherine, no harm. This is mother's choice. I always believe in mother's choice. Mother has a choice to decide what they want. But when you choose a Caesar, no problem. You just say, I want Caesar. Every doctor will do for you. Even if you ask me you want to do Caesar, I will also do for you. I may try to find out why and hope that the only difference is, the only thing I will do for mothers who choose Caesar is I will want to know why, and I will try to debunk your myth if it's a myth. But if it's a fact and it's really your choice, I will respect your choice as well. It is mother's choice. Well, but these mothers need to understand the risk they are going through, and they must willing to settle with 3 children, settle with tying the tubes. I mean, it's mother's choice, ma. It's not your choice, it's not my choice. Amira said that she got emergency Caesar last time because of baby small. Is there any way to have SGA baby for next pregnancy? I think I need more stories, more detail about why you actually end up with cesarean. Because small babies by right should be easy birth, so why need to do emergency Caesar, which I do not understand. And your SGA, we also need to look at your size. There's this paranoia recently over the last 2-3 years, especially in the government hospitals. They're very paranoid about small babies because sometimes I feel they're a bit overdoing because a lot of mothers are very small size. Very tiny mothers. And if they have tiny babies, what's wrong with that, right? No harm. So, yeah. I really need to know a bit more about your story, so it's not simple. If possible, attend the seminar because my Vbac Seminar will have Q&A. Then you can ask a bit more questions and give more details about your birth. Linda asks, does high cervix pose difficulty for normal childbirth or result to Caesar when baby is categorized as big baby? But mommy gained only 4 kg and not engaged even during contraction. Mommy is 150. Mommy is 150 means mommy is small. So unless baby is very small, then it's fine. If baby is very big, then it's a bit too big for you. But it depends on your cervix. I do not know what you mean by high cervix. But what we do is that it's more accurate in measuring the cervix, whether it's easy or difficult to go, is easy or difficult to open, is your cervical length. Cervical length is very easy one. You just need to do an ultrasound scan. Every gynae know how to do cervical length. And based on cervical length, we already can know. That's why I even take online consultations from mothers that was in Sabah and Sarawak because they want to try Vbac. They made an appointment for me. Yeah, I forgot to tell you, you can always make an appointment to see me online even if let's say you cannot make it for the seminar. And they just go to their gynae and get a cervical length measure, and I will be able to tell them what they need to do. Okay. Ray Ross says that she's now 33 weeks and still breech. Got 2 scars, first and second child. Third child is Vbac. Still have chance to do ECV Depends on the doctor lor. So normally to us, if 1-time scar, we will still do ECV lah. 2-time scar, I've not done it before lah. I don't know whether I dare to do, but first time I have done a lot lah. So yeah, it all depends on your doctor lor. Yaya Nubaya, she had Caesar after 2 natural birth, and now 3 years plus, pregnant again, and at the first trimester pregnancy, is it possible to go for Vbac? Of course, you are very possible to go for Vbac, and your chances of a successful Vbac is a lot higher than everyone else because you already have 2 natural births, so your birth should be quite easy. Okay, last time the doctor say the baby was 4.2 kg and still breech at 36 weeks. So you wait until 38 weeks and then you go for Caesar. So yeah, you were not given a chance. Actually, it's a very simple one. Your last one, either you have done an ECV, then you can go for a natural birth, or you should have Caesar before your baby is, sorry, not Caesar. You should have induced labor before your baby is 4 kg because it's the pregnancy already. Sure, very, very easy to give birth one. Just need to induce 4.2 kg. Your doctor Caesar, I don't blame your doctor at all. But the right thing to do is to induce your baby earlier. Okay, not sit down and wait. Maybe at the end, if you sit down and wait, it's not 4.2, it's 4.6, 4.8, and then there may be risk to your baby. This time, Yaya Nubaya, my only advice for you is don't let your baby grow so big. You need to be on a very strict diet. Attend my Vbac seminar, then you know what diet you are not supposed to eat. Hui Ning asks, is Vbac a full day online seminar? No. All my seminars are not live one. My videos are all recorded. You will get a link to watch my video. After you watch all the video, then we have Q&A session. So it is not an online, so you have time to watch. We give you 1-2 days to just watch all the videos. We have like series of videos on different topics. You watch all the videos over a day or 2, so that all of you can watch 1 time, 2 time, 3 time until you absorb everything. And then only we will have a Q&A session. So the video you can access for a certain number of days, not forever, and then after that you cannot access already. So I really give you enough time to really listen, and I feel that it's a lot better than live even. You know, when you have face-to-face seminar, sometimes you may not catch certain fact. I say already over already lor. But if it's pre-recorded, you can replay and replay and replay, which I realized because recently a lot of online conferences that I joined, and in fact when online I cannot get the message because sometimes internet not so good, you don't hear everything, but because they keep the video there in the website for another week or so, and or some of them keep for 30 days, and then I actually prefer to watch it later slowly. You know, when you watch it later slowly, you can really absorb everything. So that's why my seminars are all pre-recorded videos. We give you a few days to watch. Elaine asks, you still help to deliver natural? Okay, I still do all my Vbacs myself. Easy birth I don't do lah. I always say I don't do easy birth. Basically, I choose my mothers nowadays. You can choose me, but ultimately I will still need to. I will still choose who I want to deliver. Easy birthers. If I see you, baby nice size, cervix so nice. All this I don't deliver lah. All this you just simply go as long as the doctor is a reasonable doctor, will still be natural birth. No need me. But Vbacs are the type that I still manage almost throughout the whole journey. Maybe not until the very end. 10 centimeter I pass off lah. Let other people do lah. Already want to come out. Okay? But most of the Vbacs I still manage until almost the end. Hi Dr. Tan. If possible, the placenta can attach to the previous scar inside. Yes, such a complication can happen. And this is one complication that we worry for the mothers. Caesar, that is why we don't let you Caesar too many times, because just in case your placenta stuck into your old previous scar, then your birth is going to be very, very high risk. It rarely happens. I think in my let's not talk about government. You know, government, this type of thing is like everyday thing lah, because they have so many births. But let's say for my practice in private, I have been private from 2004, so already 16 years. I have only seen 2. But the 2 that I see also, we already detect at a very early stage, so we actually didn't let the pregnancy go on. So if we didn't let the pregnancy go on, then no risk. yeah, we abort the baby at early stage, so we don't give any risk to the mother at all. But unfortunately, in government, a lot of times nobody knows that they have this situation, and as a result, you only appear in the hospital like 7, 8 months, 9 months. Then by the time they know, it's a bit too late to give up on the pregnancy lah. Actually, if you give up on the pregnancy, you could save everything one. Yes, you lose the baby, but we don't lose the mother, and you will still have a chance to go for natural birth again the next time. So actually, it's better to just give up on the pregnancy. That is what we do when we see placentas who stuck onto the previous Caesar. Because if the placenta is stuck on the scar, then the placenta will never be able to remove. So that is when it's very high risk to the mother. ICU is definite. So in this type of situation, we call placenta accreta. I think I have one Facebook post on placenta accreta because I had one recently, but it's not too bad an accreta because mother didn't have a previous Caesar anyway, so it's a bit different. But most placenta accreta are very, very high risk one, especially those with previous Caesars. Okay. Esther thanked us. Any period gap for VBAC after first Caesarean delivery, we say the longer you wait, the safer it is. So how long you willing to wait? You wait lah. 2 years, 4 years. The longer you wait, the safer it is. The shorter you wait, the more risk of scar rupture. So we say minimum, to be on the safe side, minimum the gap of the 2 babies should be minimum 2 years. That means the last Caesar should be given 2 years time before you try to deliver normally again. So your 2 children must be more than 2 years in age. Shirley asks, hi doctor, some mother very hard pregnant, got any idea? If you are saying, talking about trying to get pregnant, or that so happen, that is my next topic. Next week, I'm going to talk on fertility. I'm going to talk on fertility. So my next week, Sunday, 9 p.m. Video is totally on fertility. And sometimes, if let's say you have 1 Caesar and then after that you cannot give birth, you cannot get pregnant again, which is a problem. Caesar can cause sometimes complication of the Caesar scar, can actually cause some women cannot get pregnant the next time. And this also will be one of my coming talks in the next 1 month or so. I plan to talk about the complications of scar in not in childbirth, but complication of Caesarean scar in your future gynae health. So which I'm going to talk about in the next a month or so. If you have any other topics that you want me to talk about, please put it in my comment section. Okay? And if you have and please also visit my YouTube channel. My YouTube channel is Dr. Tan City Clinic. That is where I have all my old videos, all my old live videos are there. Do subscribe because in the future, most likely I won't be doing live, but I'll be just doing YouTube videos only. So do subscribe to it so that you will always be able to watch all the latest videos that I'll be posting. I kind of enjoy this video thing. I plan to do it probably long term, and probably will also be my hobby when I retire one day. So I think you must be prepared to see me on Facebook and YouTube probably for another maybe 40 years more to go. Okay, 40 years more to go. Oh my God. Okay, I plan to do this because I think it's very interesting, and if I retire from work, I will still want to share. Okay, so that's all for today. Thank you and bye-bye.